everyone, this is Dr. Raghu, cornea and refractive consultant, Apollo Hospital, Sheshadripuram. Today we are going to discuss something called digital eye strain and its management, where I am going to discuss what is digital eye strain and its various treatment modality and prevention which everyone can follow. To start with, digital eye strain or a computer vision syndrome is defined when a person uses computers for more than 8 hours in a day for more than 1 month. Then he comes under the bracket of computer vision syndrome. So in this, what really happens is the patient develops dryness in the eye, which in turn causes irritation, watering, redness, and also can develop headache and neck pain. So what lifestyle changes they can acquire so that they don't get into this bracket of computer vision syndrome? To start with, the most common is frequent blinking when you sit in front of computer. That means a normal person blinks around 16 times per minute, but when someone stays on any artificial gadgets or computers or laptop, their blink rate will reduce significantly. This in turn causes dryness. This dryness leads to other symptoms of computer vision syndrome. So they need to blink frequently when they sit in front of computers. Other than that, they can use anti-glare glasses. These anti-glare glasses can be UV protective glasses or blue filter glasses. This also helps in reducing the amount of strain induced on the eye when they sit in front of computers. They can use artificial tears or lubricating drops. More specifically, they can use carboxymethyl cellulose, HPMC, or polyethylene glycol or sodium hyaluronate. They can use any type of lubricating drops. The advised frequency is somewhere around 4 to 6 times when they sit in front of computers. And also dietary supplementation, like they can use omega-3 fatty acids, they can use bilberry extracts, which in turn avoids some amount of dryness which is developed. Along with that, change in humidity. When you sit in a room and you are working in front of computers, and if the AC is on, then the humidity will reduce. This in turn causes dry skin and also dry eye. So always check your humidity levels. You can use humidifiers or you can adjust the thermostat in the AC so that the humidity is well maintained within the normal range. And when you use laptop or computers, keep it below your shoulder level. This in turn covers your cornea. More than 1/3 of the cornea is covered, so that your blink rate as well as your dryness, which is developed by exposure, will reduce. The blink rate will increase, and also the dryness development can also be taken care by this. Always take breaks when you sit in front of computer. There is something called 20-20-20 rule. That means a person who works for more than 20 minutes has to see an image which is 20 feet far away from them for at least 20 seconds. This in turn relaxes the muscles in the eye called as ciliary muscles will get relaxed, so they don't develop accommodative spasms. Also, you can adjust the screen brightness. You can keep it in auto mode, where it will adjust based on the atmosphere in and around you.